Here's a little PSA for all my ICU nurses out there or anybody that takes care of patients on vasopressors. Finger sticks for blood glucose checks are not very accurate in patients that are on pressors, especially when the patient is on high amounts of pressors or several of them. And the reason why is because we know vasopressors cause vasoconstriction, which means that these little tiny capillary beds that we normally poke to get a patient's blood sample to check their sugar are also constricted. So when a patient's on a lot of pressors and you check a sugar from their capillary beds and poke their finger, you're not going to get the most accurate blood sugar. I've had patients that get a blood sugar check when they're on multiple pressors and their sugar shows that it's like 40, but then you check it from their arterial line or another venous source and all of a sudden it's 100. It's always a good rule of thumb to kind of take a look at your patient's blood sugar checks and see what they've been trending to make sure it's on track and makes sense for that patient. I also like to compare my finger sticks to my actual labs that were drawn off of the patient to get an idea if like finger sticks are actually going to be accurate for this patient. So I thought I'd just throw that out there because I think a lot of nurses don't really think about this or know this, and it really truly makes a difference in how we care for our patients.